Irritable Bowel Syndrome or IBS is a common condition. Almost around 10% of world's population is affected by it. It generally occurs in late teens to early 40s, and women are more commonly affected by IBS compared to men. But what is this IBS? What are the symptoms of IBS? What are the alarm symptoms of IBS, and when should you visit your doctor as soon as possible? Come, let's find out in today's video. IBS is a disorder of gut-brain interaction. There is a miscommunication between the gut nerves and the brain, which leads to increased perception of pain and bloating. Along with this, there is also a change in the bowel muscle contraction. So either there can be loose stools or constipation or a combination of the two. Some of the risk factors for IBS are female gender. Women are twice as likely to develop IBS symptoms compared to men. Especially during their periods, the IBS symptoms tend to flare up. People who are experiencing emotional stress, tension, anxiety are also predisposed to IBS symptoms. Almost around 50% of symptoms worsen during a period of stress. Whenever this happens, the symptoms flare up, the patients get more tensed about the symptoms, and then it becomes a vicious cycle. A family history of IBS, a previous history of physical or sexual abuse, a previous severe GI tract infection also predispose one to IBS. Certain alarm symptoms like blood in stools, low hemoglobin level, loss of weight, loss of appetite, fever, recurrent use of antibiotics, or someone over the age of 50 should immediately visit their gastroenterologist. In such situations, a colonoscopy would be recommended. Colonoscopy is a procedure in which a small fiber optic scope is introduced through the anal canal, and the entire large intestine and a small part of small intestine are examined. If there are any swellings or ulcers during this procedure, they can be biopsied. Certain diet and lifestyle changes are extremely helpful in patients with IBS. Keep a food log to identify triggers. The most common triggers are spices, masala and oily food, fried and fatty food, tea, coffee, wheat, dairy products, alcohol and smoking. Eat small frequent meals instead of having larger meals. That is extremely useful in IBS. Also, consuming diet high in fiber is useful in patients, especially who are constipated. When these common diet modifications are not helpful, a low FODMAP diet is what is recommended. FODMAP means fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are seen in wheat, nuts, lactose, and apple. These are basically sugars that are poorly absorbed in the small intestine of some people. So these sugars reach the gut bacteria. They are fermented by the gut bacteria, produce a lot of gas. So because of that, there can be abdominal bloating, discomfort, cramps, constipation, or diarrhea. So just if you Google for FODMAP diet, you'll get a whole list of things that have a higher FODMAP. And avoiding high FODMAP can alleviate the symptoms by almost 50 to 80% in patients with IBS. IBS cannot be cured, but the symptoms can be well controlled. There are certain medications available to control the flares. Also, mind and body exercises like yoga, meditation, breathing exercises, and certain psychological therapies like hypnotherapy or cognitive behavior therapy are useful in managing IBS symptoms. IBS typically does not cause any damage in the intestine, does not cause any cancer or any long-lasting illness. Most of the times, patients do not worsen with time. In fact, 1/3 of patients with IBS get better over time and may become completely symptom-free.